All right, guys, we got Joe here again. We're gonna do a knee assessment. So I do have a lot of patients who come in, they have knee pain, whether that's through an athletic injury or just some chronic pain that develops over time. So what I'm gonna do here today is I'm just gonna show you a quick knee assessment of what I do. A lot of the times, if it is a severe injury, we will just refer out if there is any sort of ligament damage or anything like that. But there are some different things that we can do for the knee to help not only provide pain relief, but then also help with, if you are an athlete, help with athletic performance too, just to make sure those joints are functioning properly, right? So say we have an athlete come in, they have some knee pain here. First thing I'm gonna do is just take them through passive range of motion. And so we like to go into full flexion here, okay? Bring them into full extension here. Make sure there's no pain with any of those ranges of motion. Then I'll prop his leg right next to my thigh here, and I'll press in through here on the side of the knee and the outside of the knee there, just to make sure that there's no valgus or varus laxity there, okay? Any sort of laxity within that could be a sign of some sort of ligament damage, and we don't want to mess around with those too much as far as adjusting goes. The other one that I'll do on all my patients is I'll place his foot flat here. I'll put my knee onto his foot just to make sure it doesn't go anywhere, and I will press forward and back, right? We want to make sure that the ACL and PCL are intact, and we don't want to be pulling or adjusting on anything that has any sort of ligament damage within there, okay? Lastly, what I'll do is take them into a little bit of internal rotation and go from a flexed knee to an extended knee with a little bit of internal rotation there, and then a flexed knee to an extended knee with a little bit of external rotation in there. And if I feel a lot of grinding or popping, or the patient says, hey, that's super painful, that might be a sign that we have some sort of meniscus tear in there, okay? But let's say that Joe came in, all those tests were negative, nothing painful within there, but we just have some general knee pain or tightness. There is something that we can do as far as adjustment goes. Now, the knee is a joint of stability, so we don't want to provide a whole lot of motion in there, and we really want to make sure that the muscles connected to the knee are strong, right? But there is a muscle test that I do to test the muscle that attaches the femur or the long bone of the leg to the tibia, or the shorter bone of the leg, and it's called the popliteus muscle. It's right in the back of the knee here. And sometimes if this presents as weak, I'm gonna have him hold strong here. And let's say he just is a little weak there, okay? He's not able to hold on to that. That could be a sign of what I call a posterior tibial shift, right? So that tibia, or the shorter bone of the leg, shifts backwards just a little bit, right? And so what I'll do in that scenario is I'll bring them up, okay, into this position here, and I'll just use my forearm here, and we'll just provide a little shift in through there, just like that, okay? Now we can also go into a little bit of a long axis distraction adjustment here too. Just provide a little bit of pressure in through here, a little pull, right? And if that tibia shifted back to its normal position and we retested, should be nice and strong, okay? Now again, I always like to provide a little bit of muscle work with my patients too. We can do anything from therapeutic dry needling within the knee. We can do Graston technique. We can cup the knee. But today, I'm just gonna show you a little flossing therapy. Now what flossing therapy is, it's a form of blood flow restriction therapy. I'm gonna have you bring your legs straight, just like this. We're gonna wrap that knee up nice and tight for Joe. Pause. So one of the techniques that I'll utilize for just creating a little bit more blood flow in the knee and providing some relief is flossing therapy. Now this is a form of blood flow restriction therapy where we're going to take our patient's knee here, and I'm going to have them hold it straight there, and we're going to wrap it up super tight, okay? Just bringing this band across here and just inhibiting blood flow within the joint just momentarily, right? So we'll wrap it up nice and tight, and while the blood flow is inhibited, what we're gonna do is have Joe go through different ranges of motion and different mobility exercises here. And what I usually start off with is just passive range of motion. So passive meaning I'm doing the work for him, and we'll just go through flexion, extension in here. And right now the body is trying to pump more blood within that area, but isn't able to, obviously, because the band is restricting that, okay? After a few repetitions of that, I'll have Joe go ahead and stand on up. We'll go right over here. And then I like to have him go through some active or loaded range of motion. So I'm just gonna have you go ahead and do a single leg, and we're just gonna kind of lunge down and stand up, and just keep that going forward for me, all the way down. Now there's a bunch of different exercises that you can do, but this is a simple one to do within the office there. Perfect, there you go. After say about 10 repetitions of that, we'll go ahead and have him lay back down on his back. All right. We'll take the band off, and then when we take the band off, a process called reactive hyperemia occurs. I just like to call it the waterfall effect, where all the blood flow that was trying to get in within the joint there washes through, okay? And with that, we can decrease inflammation, okay? We can increase range of motion and decrease pain. So there's a knee assessment, a little bit of treatment for you guys. Let me know if you have any questions.